Hi, I am Nicole Marstall, and I will be presenting case study 1 today. The client I will be discussing today is a 4.5-year-old male with a diagnosis of autism spectrum disorder. The problem behavior for this study is inappropriate touching. Inappropriate touching is defined as one's hand crossing the threshold of the waist of the pants, excluding instances where this is acceptable, such as during a dressing routine or toileting routine. An example would be the client putting one or both hands down their pants while playing in the gym, and a non-example would be the client putting their hands down their pants in the bathroom in order to pull them down. Positive reinforcement is when there is a stimulus added in order to increase the likelihood of a behavior occurring in the future. When conducting an in-person interview and questionnaire with the client's parents, they reported when they observe the behavior happening at home, they will look at the child and tell them to stop. They also report that there are times the child will look at them, the parents, and then insert their hand down their pants after making eye contact and smiling while they do it. This was also observed in the initial assessment with the client and tracked using ABC data when beginning services. The behavior occurred more frequently during reinforcement times and also during independent work times. Upon analyzing this data further, it was seen that when problem behaviors were occurring, the client was not previously receiving attention. After engaging in the behavior, the parents or clinicians provided attention to the child and the behavior by either telling the client to stop, take your hands out, or telling them something else to do with their hands instead. Giving the client this attention increased the likelihood of the behavior happening again in the future, meaning that positive reinforcement was maintaining and even increasing the inappropriate behavior. The intervention used was planned ignoral. Inappropriate touching received no attention, including direct eye contact, so the client did not get the attention that was previously maintaining the problem behavior. For instance, if the behavior occurred while the client was working on an independent activity, the therapist would ignore the behavior and continue tracking data as they were before. Initially, the client began engaging in the behavior more frequently. This is referred to as an extinction burst, but ignoral remained consistent and eventually decreased. However, there were a few instances that, due to being with other peers, that it was necessary to provide some attention. In these instances, there would be a minimal physical prompt provided to remove the hands from inside the pants with no direct eye contact to still maintain as little as attention as possible. As mentioned, the motivating operation for the behavior was attention. The schedule of reinforcement was a differential reinforcement of other behavior procedure referred to as DRO. There was a timer set for 5 minutes, and when the timer went off, the client was provided with attention such as verbal praise, tickles, high fives, etc., as long as the client had not been engaging in inappropriate touching. The time increased as there was success with decreasing the occurrences of inappropriate touch. This was able to generalize at home as the parents were instructed to give attention for other behaviors and ignore the inappropriate touching. This is also maintained, and currently the client has not had any instances of inappropriate touching for going on 7 months. This shows that the treatment has been effective and successful. However, there were some obstacles during this intervention. The first was that others were not aware of the intervention of planned ignoral, and upon noticing the behavior, would provide attention to the client by telling them to remove their hand or hands from their pants. The other obstacle was that due to some social situations, it was necessary to provide slight prompting and attention to the client and the behavior. Both of these obstacles prove to not interfere with the overall effectiveness of treatment, though, as instances of inappropriate touching have decreased to 0 and have been able to maintain that for a long period of time now. So this wraps up the case study 1, and thank you so much for listening.